Used by clinicians to detect perfusion adequacy, INVOS monitoring offers reliable, timely, and actionable RSO2 measurements, helping improve patient care and outcomes. The INVOS monitor provides the capability of monitoring up to 4 sites of cerebral somatic oximetry at one time. Through real-time RSO2 data, clinicians can identify ischemic threats early and intervene sooner. Pulse oximetry is an important measurement because it reflects a global view of saturation in the body. However, its readings often remain normal when inadequate blood supply is occurring at a regional level. The INVOS system monitors at the regional level, giving clinicians a view of critical site-specific perfusion. Sensors are placed directly on the monitoring site, such as the forehead. 2 specific wavelengths of near-infrared light are used to determine blood oxygenation under the sensors. Because the 2 wavelengths are designed to detect at different depths, the readings are typically unaffected by variations of tissue. Some of the intended clinical benefits of monitoring site-specific perfusion include early warning of deteriorating patient condition, indication of undiagnosed patient pathology or morbidities, and improved hemodynamic stability. With the INVOS system, clinicians can see early indications of problems, helping improve patient safety and increase positive outcomes. Reusable sensor cables are used in conjunction with adult and pediatric sensors. Simple color and number codes help ensure clinicians correctly pair the sensor cables with the 2-channel preamps. Cables with the same code carry data from the preamps to the INVOS 5100C monitor. A USB port on the monitor enables you to collect, save, and transfer patient data. The power cord is inserted into the back of the monitor. Patients and their clinicians may benefit from the INVOS system in many care areas. While most commonly used in the cardiac OR, it can be used in any procedure that may impede blood flow. In adult patients, cerebral monitoring during cardiac surgery is an emerging standard of care. Placed on each hemisphere of the forehead, sensors detect subtle changes in physiology that can indicate a lack of perfusion. Elderly and very young patients may be particularly vulnerable to hemodynamic instability. For pediatric and neonatal patients, somatic monitoring of the perirenal and abdominal regions can provide clinicians added insight to perfusion across the body, helping them prevent ischemia-related injury through quicker intervention. When reading the values, note that the cerebral value will be lower than the somatic value. That's because when the patient is at rest, the brain has a greater basal demand for oxygen than somatic organs and tissue. Of all the organs, the brain holds the lowest oxygen reserve. It's a high-flow, high O2 extracting organ. This results in a lower cerebral RSO2 value. The INVOS system features a valuable baseline setting that helps clinicians take full advantage of RSO2 readings. Because normal values vary by patient, it's critical to establish an individualized baseline. This will help clinicians interpret real-time information and provide customized care during surgery.